We spent, I don't even know how many hours interviewing a bunch of them, doing super deep dives. I wrote out my must-haves, nice-to-haves, the EHR side versus the data collection versus like the OBM applications, and have scores across all of them. And Hi Rasmus definitely far beat the other main competitors I was looking at. And then their price point was really solid on top of that. And then beyond that, they are so collaborative. And I can say for our RBTs, they have commented on how much easier it is through Hi Rasmus versus our last platform and other platforms they've used at other companies. It's just really user-friendly, really easy to navigate. A lot of our onboarding phase was really them teaching us how to use the system to create all of our templates. I've never been able to make my own session notes and treatment plan templates in a system before. And so I have full range of however I want to set it up to demonstrate medical necessity. We're doing so much more than what is minimally required. We have to put in our goal hours with justification for each goal, which has strengthened our medical necessity request. We get a lot less pushback as a result, and I was able to drop that in to my report template. And then they were able to, on the back end, show me trials criterion per target and per goal, which I use in a calculator to then demonstrate medical dosage for that goal based on the kid's acquisition. The SOAP note features, I've been able to do so much where a lot of it now is checkbox drop-down style, and it has limited session note writing to max 10 minutes for an RBT session and 15 for a BCBA. Nice for overhead, right? It's we've shrunk that part of the overhead to make operations more efficient. But two, it's been great for staff satisfaction and retention. None of our staff enjoy the documentation part because they want to spend their time in session interacting with the client. They don't want to be focused on the paperwork. And the BCBAs want to spend time supervising the RBTs. They don't want to spend their whole session staring at graphs, trying to interpret things and then summarize them in writing. So with Hi Rasmus, it's basically little folders where you have your clients, and then after that you have your staff section. If you view your staff member as another client that has their program in there, what I've got is the staff member pulls up. When I click on them, I can look at their programs, if you will, which would be things like, if they're brand new, I've got their RBT onboarding, which is one program that goes through each day of onboarding with their assignments, and then I have targets set up for their in-person competencies that we do in person for that day of training, and then their quiz is their final competency for that day. After that, once they pass the onboarding sessions, then concurrently they're working on their training checklist, which is my own modified version of the RBT competency that goes a little bit further because we're an ascent-based company. And then once they pass their training checklist, it moves into their fidelity forms, which are tied to our bonus metrics and promotion metrics. So the training stuff doesn't count against them. It doesn't show up in their graphs. I have it as a separate section of their probation report. So once a week, I run a report for everybody that is on probation, so I can check their performance metrics and then send them their report to show them this is where you're at and this is how close you are to passing probation. We were able to work with Hi Rasmus to design what we wanted our key performance indicators to be on those reports. And so what things that we're measuring are percent behavior reduced from baseline for each behavior per kid. And then we are looking at skill acquisition change based on dosage received versus dosage prescribed. I'm able to look at staff fidelity across different roles. We're also working on right now getting it set up on the back end for the kids to designate them different profile types. So that way we can start looking organization-wide at level 1. What's this expected skill acquisition going to be per hour of treatment, and then versus a level 3. So that way we can start predicting better in our treatment plans how long they're going to be in treatment. With Camber and Hi Rasmus, we were talking about looking at how we can use Camber's data mined information that they get by state by funder, because they can get it down to the zip code, and looking at how we can use that in the state to start help educate providers on how to negotiate to get sustainable rates. That's the biggest threat to our industry right now, is that the rates aren't sustainable, and we have so many people finishing their graduate programs and going right into business and don't understand what the cost of doing business is ethically. It's way more expensive to be an ethical company and focused on quality provision. Like, if you want to align with generally accepted standards of care, the overhead's much higher. And so you have to know what your bottom line is to maintain enough profit to not just cover the cost of your business, but give you room to grow and expand your business, because your ultimate initiative should be to increase network adequacy, serve our underserved populations.